Emily Rosas, student ID number 3162124. This is for VTHT 2223 Fall 2025. Today I will be getting a jugular vein puncture on a canine patient. This is my patient for today. His name is Keem. He is a 4-year-old neutered male Old English Bulldog. So to begin, we are going to get my patient into restraint for his jugular vein puncture. Alright, buddy. And my supplies for today are going to be alcohol, a cotton ball, and my 3 ml syringe. So I'm going to start off by soaking my cotton ball. Okay. I'm going to hold his neck by the thoracic inlet and gently push down to occlude his jugular vein. Wherever I feel his vein, I'm going to rub the alcohol ball. I'm going to take my cap off, and with the bevel pointing towards me, I'm going to collect my blood. Okay. Okay, and once I've done that, I'm going to hold the venipuncture site for 30 seconds. Scoop up and close my syringe and make sure that he's no longer bleeding. And that is it. Okay. My name is Emily Rosas, student ID number 3162124. This is for VTHT 2223 Clinical Pathology 1 Fall 2025. Today I will be demonstrating how to get a cephalic venipuncture on a canine patient. This is my patient for today. This is Creed. He is a 4-year-old Old English Bulldog neutered male. My supplies for today are going to be a cotton ball, alcohol, and my syringe with needle. Okay, so to start off, I'm gonna soak my cotton ball in alcohol, and then we are going to get him into sit restraint for his cephalic venipuncture. All right, baby boy. Okay. So my restrainer is occluding his cephalic vein, and I am going to just swab the alcohol where I will be poking him. From here, I'm looking for his vein. And once I feel it, I am going to have my thumb hold it steady so it doesn't move on me, and I will be uncapping my needle. Okay. With the bevel pointing up towards me, I am going to poke him. Alright, and once I feel the blood, I am going to slowly pull back my plunger. And once I am done, I'm going to have my restrainer release the hold. And I'm going to hold his site. It's okay. And I'm going to scoop up my cap. Okay. My name is Emily Rosas, student ID number 3162124. This is for VTHT 2223 Fall 2025. Today I will be showing how to do a lateral saphenous venipuncture on a canine patient. This is going to be my patient for today. This is Squire. He is a 7-year-old Labrador Retriever neutered male, and he already is in lateral recumbency. My supplies for today are going to be alcohol, a cotton ball, and my syringe. So to begin, I am going to have my restrainer occlude the vein that runs along here, his leg, and I'm going to feel the vein first and hold it with my thumb in place. I'm then going to soak the cotton ball with alcohol, and to present the vein, I'm going to just rub the alcohol ball on his skin. And with my bevel side up, I'm going to poke him. All right, and then I'm going to hold my place before I pull out. Okay, I'm going to close my syringe like so, and I'm holding him. I'm holding the spot so that he stops bleeding, and that is all. My name is Emily Rosas, student ID number 3162124. This is for fall 2025 Clinical Pathology 1 VTHT 2223. Today I am going to be demonstrating how to make a blood smear. So my supplies needed for this are going to be my blood that is in a EDTA tube or lavender top. I'm going to need 2 slides, and I am also going to need a dropper. So taking the blood, I am going to uncap it and get a small amount of blood, and I'm going to place 1 medium-sized drop into the slide near the frosted side. Okay, like so. And then taking the second slide, I'm going to align the slide on top at a semi-angle. I'm going to barely touch the drop at the very top, and in a very rapid motion just push forward. Okay, and then this is going to be what your smear would look like. The feathered edges on top, the counted sides in the middle, and then the packed cells at the bottom. And now we just set it aside in order for it to air dry before we stain it. My name is Emily Rosas, student ID number 3162124. This is for VTHT 2223, Clinical Pathology 1, Fall 2025. Today I will be demonstrating how to stain a blood smear with the stains. So my supplies are going to be my blood smear that has already been dried. Here is a better view of it. And then I have a clip that will be holding my blood stain. I have a bibulous paper to help dry the stain at the end, and I have distilled water for the final rinse. So the stains consist of a fixative solution of methanol that we will be staining for at least, or we will be holding it in here for at least 60 seconds before staining it with the rest of the stains. This is a buffered solution, which is eosin, and it is buffered to have an acidic pH, and it stains the most basic parts of the cell. And then lastly is our right stain, which will be doing an average of 30 seconds each in both of these stains. So to begin, I'm going to clip this at the frosted side, and we're going to dip it in here for 60 seconds. Once we are done with the final dipping, we will rinse off the excess on the back of the slide that is not the frosted side, and we will just rinse it with distilled water and dip the excess water on a paper towel. And we were going to take our bibulous paper and go through the clean pages to dry it as best as we can. And then from here we take our dried blood stain, and this is going to show us the thickened area here at the bottom, and then our counted area in the middle, and our feathered edge at the very top. And now this is going to be ready to do a differential cell count. My name is Emily Rosas, student ID number 3162124. Today I am going to be demonstrating how to perform a differential cell count on a stained blood smear. This is for VTHT 2223 Fall 2025 Clinical Pathology 1. So my supplies for today are going to be a microscope and immersion oil and my stained blood smear already. So to start off, I'm going to put the slide onto the stage, and we are going to turn on our microscope, and at the low power magnification of 100 times, we are going to be scanning through the whole slide, and we are going to use the fine and the coarse knobs to adjust the magnitude and the lens to make sure that we're able to see thoroughly. And we're going to slide through the whole, we're going to scan the whole slide, and we're going to watch out for any abnormalities, any platelet count, or sorry, platelet clumping, any microfilaria on here or anything like that. And then from here, we are going to, once we've scanned through the whole slide at this magnitude, we are going to move to a high power magnification, and we are going to identify the monolayer of the slide and the feathered area. And so once we found those, once we found those areas, we are going to switch this to the oil immersion side, but we are going to apply a drop of our oil immersion to begin our differential cell count. So we apply the drop, and once again we are going to adjust to be able to see properly using the fine and the coarse knobs. Okay, once we are able to see clearly through here, we are going to count at least 100 white blood cells. Once we've identified the white blood cells and counted 100 of those, we are going to count and take a note of how many different types of white blood cells are on here, and we are going to write that down as a percentage, and that will be that would be the differential cell count. Now moving on to our platelet count, that one we are also going to be focusing here on the oil field magnification. We are going to be focusing on the little dots, our platelets. We are going to count how many of those are in 10 different magnification fields. We're going to make a note of that, and once we have counted the amount of platelets in 10 fields, we will average that and multiply that by 20,000, and once we've multiplied that, that'll give us a rough estimate of our platelet count. My name is Emily Rosas, student ID number 3162124. This is for VTHT 2223 Fall 2025 Clinical Pathology 1. Today I am going to be demonstrating how to do a packed cell volume and total protein test. My supplies for today are going to be my blood, my blood in a EDTA tube, my lavender top, that had been rocking gently back and forth in the rocker back there. I am going to use the microhematocrit tubes that are heparinized. We will be needing the heparinized tubes today to prevent clotting to be able to read the plasma. You would use the non-heparinized tubes whenever you need clotting to be done for a serum reading. And lastly, I have the clay sealant as well. So to begin, I am going to pull out 2 tubes from here. Okay, and then I am going to take the lid off of the purple top, and I'm going to place my tube at an angle so that the sample is able to go into the tube by itself, and I'm only going to fill it up 3/4 of the way. And it's just going to automatically go on its own. Okay, and then I'm going to put my finger at the top of the tube while I push down onto the clay sealant to prevent the blood from leaking out. Okay, and I'm putting it like so, and I'm going to repeat the same thing onto the second tube. I'm just gonna tilt it to the side at an angle and let the sample fill up the tube by itself. Okay, and then I'm going to apply the sealant to this tube as well. Okay, and now from here I am going to place the tubes into the centrifuge diagonally across from each other, with the clay side towards the back on the outer edge. Okay, and I'm going to cover it up. And I'm going to let it spin for 5 minutes at 1200 RPM. So after my tubes have spun down, I'm going to take them out, and I'm going to show you how they look spun down. So the bottom here is going to be the red blood cells. The white band in between the plasma and the red blood cells is the buffer coat. It's like a milky white, and then this is all going to be the plasma sitting on top. So my next supplies are going to be the micro hematocrit capillary tube sheet that's going to show us our packed cell volume in percentage, and we are going to use a refractor to see the total protein in grams per deciliter. So in order to get the packed cell volume, I am going to align the bottom of the tube where the clay and the red blood cells meet at the very bottom at the 0 line, and I'm going to slide the tube over up until the meniscus of the tube at the top layer of the plasma meets the 100% line. And I'm just going to read above the buffer coat. So this patient's packed cell volume would read as 43%. And then in order to do the total protein test, I am going to split the tube in half above the plasma, pour out the plasma. Okay, and this is going to get disposed of in the biohazard bin. And I'm going to gently tap the refractor to get a drop of the plasma on here. And you're going to want to do it gently. Okay, and then from here you are going to point it towards the ceiling and maneuver the knob for you to be able to get a clear line. And you're going to be looking at the left-handed side and to get the values. And this patient's total protein is at 7.6 grams per deciliter. And once you are finished, you are going to clean it with a distilled water. And you're going to wipe it with a Kimtech wipe. And you dispose of the rest of the tube in the biohazard bin. My name is Emily Rosas, student ID number 3162124. This is for VTHT 2223 Fall 2025. Today I am going to be demonstrating how to prepare a blood sample to go out to the laboratory. So to start off, I have my labeled serum separator tube that's already been spun down, and my EDTA lavender top. And I'm going to place stickers on there that have the client ID number and the patient and client information. And then I am going to take the requisition form with my client and patient information and the clinic that it's from. And I'm going to stick it into the IDEX bag with the outside pocket for it. And then the tubes are going to go in as well, in the actual Ziploc portion of it. I will then be getting our outside laboratory box with an ice pack. And I'm going to place this in here with the ice pack in, lock it, and we're going to put it outside of our clinic for pickup.
Hi, this is my review of Emily Rosa. She is a technician here at my clinic. This week she has shown adequate skills, if not advanced skills, in all of her venipuncture, both cephalic, jugular, lateral saphenous. She's fantastic in her cytology. She can make slides, review slides. Again, all of her skills so far have been top-notch.